Medication errors. Let's talk about it. Chances are sometime during nursing school or your early training, you heard the phrase about medication errors. It's not if, but when. And there's certainly a truth to that. It's estimated that at least one medication error happens to approximately 22% of patients. And it's estimated that about 40% of those medication errors is on the nursing level. There's a lot of contributing factors to this, but one of the top contenders is interruptions. And I've talked about this before in previous videos. When I'm precepting new nurses, I stress the importance of uninterrupted time when preparing and administering medications. This can be a little bit awkward at first, but I encourage them to tell anyone who is threatening to interrupt them during this process that they need this protected time. For example, even if a family member approaches you with a question, it's perfectly acceptable to say, this is what I'm doing right now. This is why it's important that I give my undivided attention to this for safety purposes. And I promise you, I'll get back to your question in just a moment. In terms of nursing handoff, if you are the oncoming nurse, I always encourage nurses to, again, advocate for this time being uninterrupted so that they have the devoted time to really check infusions that are running from a previous shift. During this independent check, you are saying that you checked the offgoing nurse's infusions and verified their dose. So if anything happens to where there was a mistake made on the previous shift, but you didn't catch it at change of shift, you are also held responsible for that error. Additionally, if you're working in pediatrics, you're working with weight-based medication. So that will require calculations. Even if you're comfortable with this process, high stress situations, interruptions, etc. can have an impact. So it's important to know what medications are especially high risk. These medications include agents such as heparin, digoxin, potassium, insulin, vasoactives, sedation, etc. I was trained in a culture where we double check these medications every single time. So potassium, changing vasoactives, heparin, insulin, digoxin, all of these things were individually checked by another nurse to ensure accuracy. Even if this isn't your institution's policy, it's something I would strongly encourage, especially if you're a new nurse. Another situation that medication errors happen commonly is during peri-arrest and arrest scenarios. Some hospitals have an abundance of resources and you have a pharmacist at your disposal during these situations almost immediately. Other places, it's solely the nurse's responsibility to draw up these medications. And as you can imagine, with the added pressure and urgency of the situation, this can lead to more errors occurring. Again, I come from a culture where any medication that we drop during these arrest or peri-arrest situations is dual verified by another nurse. I understand that this isn't always possible, especially if you work in a small unit where there are only a couple of nurses staffed at a time anyway, and someone's doing compressions and someone else is getting the code card and doing other things. So I certainly understand that, but if it is a possibility, I think it should be prioritized. Cannot tell you how many medication errors have been caught just by having another nurse eyeball an arrest medication. I feel like anxiety, interruption, and high stress situations are the kind of most pressing issues with medication errors when you're talking about new nurses. However, I think it's also important to mention that as you gain experience in your nursing career and become more comfortable in practice, that it's also really important to combat complacency. There is no room for complacency when you're taking care of patients. You have to always be vigilant and intentional about what you're doing.